Hello and welcome to Local Edition. I'm Leslie Leyton. Coming up in November, more propositions to consider. Proposition 45 and 46 would deal with the cost of health insurance and drug testing and consequences for doctors. With us now is Upland Mayor Ray Musser to talk about these propositions. Welcome.
Hello, Leslie.
Hello. Explain a little more about what Proposition 45 is.
Proposition 45, currently the insurance commissioner works and negotiates with insurance carriers to work out rates and even coverage. And it's a negotiated kind of thing. This change would make the insurance commissioner will make that decision. And we're concerned that we will lose a lot of carriers when that happens.
I think when the propositions roll out and people start hearing about it, what they're going to hear in some of the advertising is that the insurance commissioner is going to keep those rates from going up.
That's right.
People are going to think that's a good thing.
Yes.
So why is that not a good thing?
Only because he cannot control it. And number two, there is inherent costs, and there's special interest groups behind this, pushing this, and that will increase the cost.
How does it increase the cost if you don't increase the rates, if the insurance companies?
Okay, the rates will increase the next year, and the problem is when you control it, if people can take higher deductibles, higher co-pays on their own, and especially in what we used to call insurance, but it's health care, you'd be able to take some risk on your own. But now that's being taken away from you, and you have lower coverage. You hardly pay anything out of your own pocket. And the more you pay out of your own pocket, the better you will do. When was the last time you washed your rent-a-car? Not very much. You rent it and you don't care about it. But in this case, when you care about it and it's your possession, then you'll treat it properly.
So you say it's not as cost controlling as it appears on the surface. Proposition 46, tell us more about that.
Okay, there again, the trial lawyers are asking the doctors, number one, to have a database in California. That is scary after you hear what's happened to Home Depot and many, many other organizations, especially when it's your personal information. It's health, it's very personal. And also they are going to lose the privacy, their personal privacy, and also it'll increase costs. Most doctors say it's going to increase costs by about $1,000 doing it this way.
You're talking about making patient records available nationwide? Why isn't that a good thing? If I arrive in an emergency room and I'm unconscious and the doctor knows who I am, he can find out all my medical history.
If you do it gradually, it is a good thing. Kaiser has done this better than anybody else. They have controlled costs with their physicians, and they can control sharing throughout. And Kaiser is just not in California; it's elsewhere, Colorado and elsewhere. And so, therefore, you can go wherever Kaiser is. That's a good thing. But we got to merge all these other companies in that are nationwide. Different systems, and all the doctors have their own systems.
But isn't there an opt-out of this proposition that you don't have to become a part of the the statewide data?
That's right.
But
you're not a player then. You just don't have access. You won't qualify for the HMOs.
And what about the part for drug testing for doctors? Quickly, we just have 15 seconds.
Okay, for them, that is something that would be required. I would hope would be required.
And the consequences because
consequences.
Okay, so that part you're not debating at all.
No.
Okay, very interesting. Thank you very much.
Thank you.
Upland Mayor Ray Musser for
Thank
being
you.
here today to talk to us about this. And thank you for joining us. I'm Leslie Leyton.